Our third panelist is Michelle Sherman, an advanced practice pharmacist with Radiant Health Centers. Michelle is an internationally recognized HIV specialist pharmacist. After opening the first HIV specialty pharmacy in Southern California, she created the Ubuntu Pharmacist Care program, which manages drug therapies for people living with HIV. Michelle has also established a nonprofit called the Center for Advanced Pharmacist Care, which promotes pharmacists as critical healthcare providers on a patient's care team. An author and speaker, Michelle is the host of the Conscious Pharmacist podcast. Michelle was raised and educated in South Africa.
Hi, everybody. It's a pleasure to be part of the Orange County Women's Health Summit and to be able to present the LGBTQ sexual health care in Orange County to all of you. So it's a pleasure to be on this webinar today. Next slide. I'm going to tell you a little bit about Radiant Health Centers, and many of you are probably very familiar with the organization. It was formerly known as AIDS Services Foundation of Orange County, and they've been providing HIV social services in the community for over 30 years. They've recently, a couple of years ago, changed their name to Radiant Health Centers, and they're the largest provider of LGBTQ health and social services in Orange County. Some of the services that are provided are HIV services, free HIV, STI, and Hep C testing, PrEP and PEP, and RapidArc services, as well as family planning. And I'll go into a bit more detail in the upcoming slides. Next slide. So when Devera introduced me, I'm an HIV pharmacist and an advanced practice pharmacist. So all of you out there are probably thinking, like, what's an advanced practice pharmacist? Everybody's first go-to about a pharmacist is somebody standing out behind the counter at one of these large chains and standing there with your head down, counting in fives and popping pills in bottles. Well, I'm here today to tell you that that's really not what pharmacists are trained to do, and what is an advanced practice pharmacist. So back in 2013, Governor Brown signed a law. It was SB, Senate Bill 493, which recognized pharmacists as healthcare providers. And once this bill was signed, the California State Board of Pharmacy introduced a new pharmacy license designation called an advanced practice pharmacist. So I have my regular RPH license, and attached to that is an additional license, the advanced practice pharmacist license. And out of about 25,000, 30,000 pharmacists in the state of California, there's only right now about 600 advanced practice pharmacists. And we are like clinical pharmacists who can perform functions that are out of that realm that most of you think that a pharmacist does. We are able to perform patient assessments, refer patients to other providers, and operate under a collaborative practice agreement with the clinics and providers that we work with to manage drug therapy, order medications, and actually see patients. So it creates like new opportunities for physicians, hospitals, clinics, health plans to engage pharmacists in managing patients' conditions such as chronic diseases. So in the state, there's a shortage of primary care physicians and other providers. And as pharmacists, we can step in and provide these services to our patients. I mean, when we look at the third leading cause of hospitalizations and mortality for a lot of patients, it's drug-related mortality and morbidity. And there's so many drug interactions and inappropriate drug therapies out there that pharmacists are the key in providing these. And, you know, as an HIV pharmacist, I provide a very essential role with the clinics and the providers like Radiant that I work with. Next slide. So where does LGBTQ sexual health care and in Orange County come in to this whole healthcare clinic that Radiant has, and where were we prior to COVID-19? So there are not many safe places for LGBTQ individuals to go to in Orange County, either for HIV care, for PrEP, PEP, family planning and STI testing, or even transgender health. I've had so many encounters with patients where they've been judged. We heard from prior speakers about, you know, women coming to Planned Parenthood who feel safe, like having a woman provider, because they don't feel judged. Well, the same goes for people in the LGBTQ community when they go to a provider, whether it's for women's health care. Many women go to providers who don't even ask them about their sexual health, or what types of sex are you having. They don't ask those things. For many males, they are not asked those same questions. And I think for transgender individuals, that's even more judgmental. I once had a transgender woman who was HIV positive, who was seeing a heterosexual male in the community for HIV care, and the doctor and the office would not call her by the name she wanted to be called, because the ID and her insurance card said her male name. So they refused to call her under the name that she wanted to be called. And she asked for a referral to another provider who's going to provide that safe care. So there are a lot of instances in the LGBTQ community where people are not getting the sensitive, non-judgmental care they deserve, and there's also still a lot of stigma attached. So just like we heard about the stigma and the judgment that a lot of women face, well, in the LGBTQ community, that is still alive and well in Orange County. And the services that Radiant provides eliminates a lot of those issues. Next slide. So Radiant Health Centers moved and transitioned from purely like an AIDS service organization, a social service organization, to providing medical care and medical services at the clinic. We have our testing site in Santa Ana, RapidArc, and it helps fill the void of a lot of these issues that I was talking about earlier. We have the Orange County Healthcare Agency that has the STD clinic that we heard about, that provides all these testing services. And this is an additional site where people can get tested. So at RapidArc, the testers go out into the community. There's a lot of use of social media and a lot of the apps that are used, like Grindr and things like that, advertising these services. So they provide a lot of those testing services. It's a safe environment. It's welcoming and free of stigma. We provide HIV care services. PrEP and PEP are a big focus, as well as family planning and STI testing. So Radiant Health Centers has Title X funding to provide like family planning services for women and for men, do the STI testing, as well as transgender health services. Next slide. So this is just a look prior to COVID-19. So this is for the previous fiscal year, just looking at like office visits with the medical provider and kind of what was done. So with medical providers, that's either with myself as the advanced practice pharmacist, the physician, or nurse practitioners. There were 484 visits. There were 121 prescriptions written for PrEP. For HIV testing, there were 1,275 clients served. RapidArc did 639 HIV tests. We did 292 Hep C tests, 25 at RapidArc. So we used the rapid HIV test and rapid Hep C testing right then and there in the clinic. We do STD testing for gonorrhea, chlamydia, and syphilis using the extragenital swabs. Those tests are then sent off to the county for analysis. For PrEP, the additional services, we've had 619 PrEP referrals. We've had 1,051 PrEP referrals from RapidArc. PEP, the post-exposure prophylaxis, the non-occupational post-exposure prophylaxis, we've had 34 referrals. We've had, and the HIV support groups, there are 92 of those, 92 clients that have access to that. So all this was prior to COVID-19. So when March 16th hit and the stay-at-home order went into effect, essentially all the services at Radiant were closed. Next slide. Before we get to that, we'll look at some of the Title X funding and the services that were provided in 2019. So you can see we had a total of 102 female users for family planning. So women could come into Radiant and get the whole Well Woman visit and be offered birth control pills and everything else. I wanted to make a comment about this as an advanced practice pharmacist. As part of pharmacists being recognized as healthcare providers, trained pharmacists can also provide birth control services. I'm trained in this, so if women come and see me, or now via telehealth, I can prescribe birth control pills. I can provide Plan B. I can provide Depo-Provera, the injectable, as well, after a consultation and analysis with the woman as what's going to be the best and, you know, most important birth control method for her. Just so all of you out there know, if you want to find resources out in the community where pharmacists can provide this, there's a website called birthcontrolpharmacist.com, and there's actually a map on there. So any woman can log in, go to birthcontrolpharmacist.com and put in her zip code, and it will bring up all the pharmacies in the area that provide these birth control services. So when we have places like Planned Parenthood or Radiant that are at limited service and closed because of COVID-19, women can still access those services by going to birthcontrolpharmacist.com. Go to the map, put in your zip code, and it'll bring up all the pharmacies in your area where pharmacists are actually trained. So it's not like you'd walk into any pharmacy and say, I want this. You can find a specific pharmacy that provides these services and then get access to birth control services. So that's also incorporated under this SB 493, where pharmacists are recognized as healthcare providers. Next slide. This is the male family planning, so condoms, STI testing, and things like that. There were a total of 534 males seen. Next slide. These were the unduplicated family planning visits that we saw, like both male and female. The number of unduplicated males were 331, 65 females, and then the number of users, so 2 females and 7 males with positive tests, testing for gonorrhea, chlamydia, and syphilis. So patients that test positive for syphilis are referred to the Orange County Healthcare Agency, where they go for treatment and follow-up. Those with gonorrhea, the same thing. Radiant going forward, once we reopen and expand our services, we'll be treating gonorrhea as well. And we do treat and prescribe treatment for chlamydia for our patients that test positive. Next slide. So what about the LGBTQ community and COVID-19? So just like everybody else who's been speaking, this, you know, we were moving right along, doing everything just fine, seeing patients in the clinic every day, and then bam, we got COVID-19. And everybody had to think on their feet and think creatively, like how are we going to change the way we provide these services so we can still provide them. So how's the LGBTQ community impacted by COVID-19? There's increased exposure and economic disparities and barriers to care that are very well known within the LGBT community, some of which I've mentioned before. So a lot of people don't have access to healthcare. LGBTQ people work in highly affected industries such as the food service, restaurants, food service, healthcare, colleges, universities, and retail. So a lot of people are exposed more to the virus. 1 in 10 LGBTQ individuals are unemployed and are poorer than the rest of the population. And there's a lot of health coverage gaps, some of which I mentioned earlier, but people don't want to access healthcare, don't want to talk about their situation because of stigma, maybe have been ostracized by their community, and so forth. So LGBTQ individuals are at very high risk during this pandemic of COVID-19. Next slide. So looking at older individuals, there's a lot of discrimination in housing, employment, and healthcare. All these things that COVID-19 can affect. Increased risk for poverty, increased harassment, increased social isolation. I have so many of my older HIV patients who before COVID-19 were very isolated and very rarely went out into their communities. And now with these stay-at-home orders, people are even more isolated. So how do we reach our community and reach these people to help them, you know, through this issue of COVID-19? Next slide. When we look at youth, so many young kids are rejected by their families. They've been kicked out of their home, that they're homeless. So many of the youth go through extraordinary bullying by their peers and this increased risk of suicide. So COVID-19 layered on top of that exacerbates all these issues that the youth are going through. Next slide. So with everything that I've already gone over, people in the LGBT community are at increased risk for COVID-19. They have increased health risks. The community has more smoking than the non-LGBTQ community, 37% versus 27%. They also have 21% increase asthma versus 14% of the non-LGBTQ community. And as we know, COVID-19 affects the lungs. So just with these increased health risks puts LGBTQ individuals at higher risk. Also, other chronic illnesses and comorbidities, increased risk of HIV in the community, diabetes, cardiovascular disease, and other health chronic health diseases puts the LGBTQ community at higher risk. Next slide. So how did Radiant respond? So Radiant Health Centers was already doing some telehealth in psychiatry, and our focus in our RapidArc program is a telehealth program. But prior to March 16th, 100% of our services were being provided one-on-one in the clinic. The clinic closed, the whole agency closed on March 16th, and all staff was working from home. So 100% of our clinic services were providing services on Zoom for RapidArc, then we do the one-on-one testing, the HIV testing and STI testing, developed a protocol for home testing for HIV. Next slide. So this is the medical and provider services that we've provided through April of this year. So in February, we had 56 medical visits, 19 in March and 34 in April. So a total of 109. So once we start, you can see in February, we had 56 visits, and just like the other speakers spoke to, we've really diminished those quite significantly going to telehealth. The telehealth services have been very successful, but the number of visits have been much less than when we were doing the one-on-one clinic services, and people can just walk in to get testing for STIs and things like that. Next slide. Our TeleArt program, so OC TeleArt is a rapid start program. So when people get tested for HIV and they test positive, it's a program that's funded by the California Office of AIDS to get people on antiretroviral therapy between 0 and 5 days. Our goal at Radiant is between 0 and 3 days. So if I see a person on for rapid start, I can get them started on treatment either today or within 3 days of their diagnosis. Next slide. The populations that are being targeted are African American MSM, Latinx MSM, transgender women, gay or bisexual men, and transgender men who have sex with men, and as well as people who inject drugs. So this is our target group for this project. That's a 2-year project. Next slide. So where are we so far? So far we've seen 20 RapidArc patients, and 19 were started on antiretrovirals within 5 days. One individual wasn't really a candidate to start therapy right away, but we've started 19 on RapidArc, and the majority of our patients have reached an undetectable level at their next follow-up visit, like 4 to 6 weeks later. So it's been working very well, and doing this via telehealth modality has changed the way we've had to do things somewhat, because when we see the patient face-to-face in the clinic, we can do all the labs right then and there before the patient leaves the clinic. But now through telehealth, where I'm at home, the patient's at home, we've had to send them to Quest to get their labs. And the patients have been extremely compliant with getting their labs done and follow-ups on these visits. And for many patients, this is actually an easier way to attend a clinic visit than having to deal with transportation issues, how they're going to get there and go on. So next slide. We do testing and everything, and we've had to do that remotely now. Next slide. The radar home testing kits, and I know I'm over time, so we'll just go to the last slide. You know, our next steps are to reopen the clinic in early June, have PPE and do all the COVID protocol, and gradually get the clinic back to you know, full service. So I thank you for your time, and thank you so much.